In this lecture, we will locate and identify the 14 bones of the face, including the maxillae. These are the bones that join together to form a major part of the oral cavity, the zygomatic or cheekbones, the accessory facial bones. Now, these are numerous small bones that articulate with the major bones to round out the gross structure of the face. And finally, we'll look at the mandible or jawbone. Now, this is the only movable bone of the skull. So let's get started. You'll recall that the skull is made up of 22 articulating bones that can be divided into the cranium with its 8 bones, and which you can now identify, and the face with its 14 bones. So here we identify the 14 facial bones. Now, I don't want you to feel overwhelmed by the number 14 here, as most of the facial bones are paired bones. So let me orient you to the face to help you understand where I'm coming from in this lecture. Now, the face proper consists of from about this area here down. Remember that all of this is cranium, and don't forget your midline. And the bulk of the face is built around the 3 what I call cornerstone bones. The maxilla here is a paired bone. It's joined at the maxillary suture, and so we have the right and left maxilla, or maxillae is plural. We have the zygomatic or cheekbones, and so we have the right and left zygomatic bones. And then we have the large horseshoe-shaped mandible. It's a single bone, and this is often referred to as the jawbone or lower jawbone. So this is a sketch of the skull by Leonardo da Vinci, circa 1510 to 1511. Now, I show you this just to let you know that the study of human anatomy has been around since, well, at least the 16th century. And besides that, I think it's pretty cool. So back to the facial bones. The 14 facial bones are the maxilla, which is a paired bone, the zygomatic bone, which is also paired, the palatine bone or palatine bone. Both terms are good there, and sometimes you'll even hear the southern come out of me, and I'll just say palatine bone. That is also a paired bone. The nasal bone is paired. The vomer, that's a single bone. The inferior nasal concha, concha singular, it's a paired bone, so these together would be the conchae. The lacrimal or lacrimal bone, that's paired, and then the mandible or lower jawbone. So let's begin with the maxilla, again singular, or maxillae, plural, seen here in green. So as its plural name implies, this is a paired bone. The maxillae together make up the largest facial bone. The maxillae surround and support the upper or maxillary teeth, we refer to them as, and they also form the inferior rim or bottom rim of the orbits of the eyes. Now we can further see the extent of the maxilla by looking at a lateral view here. So the maxilla also forms the lateral aspect of the external nares or nose passages, and there we see a connection between the skeletal system and the respiratory system. The maxillae make up most of the hard palate, as we'll see in a moment, the roof of the mouth or oral cavity, and so there we have a connection with the digestive system. And the maxillae also contain the largest sinuses. Now there's a new term for you, sinus. Sinuses are air-filled spaces, usually encased by bone. The sinuses in the head are connected to the nasal cavity, and so we refer to them as paranasal sinuses. They act to lighten the skull. After all, they are air pockets. They act to warm air as you breathe in. The sinuses also give resonance to your voice. And by the way, the sinuses are named for the facial bones within which they are located. So we have frontal sinuses in the frontal bone, of course, maxillary sinuses in the maxillae, the ethmoid sinuses in the ethmoid bone, and the sphenoid sinus in the sphenoid bone. And we'll chat more about sinuses a little bit later. Now, when we zoom in on the maxillae, we can clearly see the maxillary suture that connects the 2 maxillae just under the nose. Now, because the 2 maxillae are connected to one another, they effectively act as a single bone, and so they are frequently referred to simply as the maxilla. Now, that's not entirely grammatically correct, but it is a common convention, and I will use it from time to time. Now, you remember the infraorbital foramina and the inferior orbital rim. Here is yet another bone that surrounds and protects the eyes. Now, there are a number of processes associated with the maxillary bones, as you might imagine, as the largest facial bones are going to articulate with many other bones. Now, remember what a process is. Process is a significant extension of a particular bone that articulates with another bone. And so we have the frontal process of the maxillary bone that articulates with, obviously, the frontal bone. Now, there are two maxilli, so we have two frontal processes, here and here. The zygomatic or cheekbones are here and here. We'll describe them in detail shortly, but the maxillae articulate with them also, so we have the zygomatic processes of the maxillae here and here. Now, the alveolus is that portion of the bone that directly surrounds and supports the teeth. So the alveolar process of the maxillary bones is that part of the maxillae that does just that. The area of the alveolar process then is right about here. Now, here in the lateral, once again, we have the frontal process, the zygomatic process, and the alveolar process. If we remove the jaw and flip the skull over, looking at the inferior aspect, we begin to see the palate or the roof of the oral cavity. Now, to keep you oriented once again, this is the foramen magnum, and this is the zygomatic arch. Now, we can see the horizontal plates of the palatine bones here, and we'll discuss those shortly. So here in green, then, we see the palatine processes of the maxillary bones. Now, that's the part of the maxillae that articulate with the palatine bones. Now, these two processes articulate at this little suture here, which seals completely so that we treat the hard palate as a single structure. The front teeth are called the incisors because they are used to cut or incise meat. We'll look at the teeth in detail in the next lecture. So this little hole or foramen is called the incisive foramen. Now, looking at a lateral view of the extracted maxilla, we can see once again in cross-section the frontal process, the alveolar process, the palatine process, and the horizontal plate of the palatine bone. Our next major facial bone, those bones that I refer to as keystone bones, is the zygomatic bone. Now, the zygomatic bone is a paired bone, as you can see here, and indeed, as you already know. The zygomatic bones are the very prominent bones that in the lay vernacular are frequently referred to as your cheekbones. If we rotate the skull about 45 degrees, then we get a nice view of the zygomatic bone's prominent location at the corner of the face. And so we have the frontal process, the maxillary process, the temporal process, and the zygomatic arch. Now, rotating 45 degrees more so that we see the full lateral view here, we can better see the zygomatic arch. Now, remember, this is that little bridge between the face and the cranium. Jumping back to the frontal view, the zygomatic bones also help to form the orbits of the eyes. And so we see the orbital processes here and here, which form the rim and lateral walls of the orbits. Now, the accessory facial bones, that's my own designation, and my term accessory here does not imply any less importance than the major bones that we are discussing in this lecture, but rather they support the major bones in forming the face. And so the accessory facial bones include the following: the palatine bone, that's paired, the nasal bone, that's also paired, the vomer, the inferior nasal concha, again paired, and the lacrimal or lacrimal bone, also paired. Now, looking at the inferior view of the skull, we can see the palatine bones. The palatine bone is paired, so we see the horizontal plates here and here. They articulate with the maxillary bones to form the hard palate or the roof of the mouth. The palatine bones themselves form the posterior hard palate. In this kind of an x-ray of the frontal skull, we can see the position of the sort of U-shaped palatine bone. So we see the horizontal plates here, the perpendicular plates here, and the orbital processes here and here. So we have yet another bone that helps to form the eye sockets or the orbits. Now, if we extract the palatine bones, we can see once again the horizontal plate here, the perpendicular plate here, and the orbital processes here and here. Our next accessory facial bone is the relatively tiny nasal bone. Now the nasal bone is paired, obviously, as you can see here. It forms the bridge of the nose. And these two little bones are connected to cartilage that form the external nares, or the entrances to the nasal cavity. Now the nasal bones articulate with the frontal bone, the maxillae, and the ethmoid bone internally. The nasal bones are small and relatively thin and fragile, and so they are somewhat easily fractured by a stiff blow to the face. Broken noses are also quite common among athletes, for example boxers, wrestlers, and even participants in some ball sports like soccer, basketball, and the like. Now the vomer is a single bone. You see it right here. The vomer forms the inferior part of the nasal septum. Now a septum is a partition or a wall that separates the nares. Now if we bisect the skull and go inside, we have this view. Once again, to keep you oriented, here is the frontal sinus. This is the sphenoid bone, and so this is the sphenoid sinus. Here is the maxilla, and this is the ethmoid bone. So here in green is the vomer, which, together with the perpendicular plate of the ethmoid bone, forms the nasal septum. Now, I think you probably are familiar with the phrase deviated septum. A deviated nasal septum, or DNS, is a physical displacement of the nasal septum, as you see here in this CT scan. Interestingly, DNS is common in about 80% of the population. Most people, of course, don't even realize they have a deviated septum. DNS involves the vomer, the perpendicular plate of the ethmoid bone, as we have seen, and the quadrangular cartilage. Now this is the cartilage that forms the fleshy parts of your nose and nostrils. DNS may cause breathing problems, snoring, frequent bloody noses, and even sleep disorders. And while DNS may be caused by an intentional or accidental blow to the face, it may also be congenital as well. Now the inferior nasal concha is a paired facial bone that can be seen just inside the nasal canals. We see it here and here. Now sometimes referred to as the inferior nasal turbinates, because as air passes through the nasal channels, it gets churned and stirred as though passing through a turbine. In this way, the air, as it passes across the mucous membrane covering these bones, gets warmed, it gets humidified, and it gets cleaned before it passes into the respiratory tract proper. Now looking inside, you can see how the air that you inhale then passes over the nasal conchae before passing into the airway. Now, by the way, this is the quadrangular cartilage here, forming the soft tissue part of your nose, and these are the superior and middle conchae here and here, respectively, which are part of the ethmoid bone. Now, remember, the ethmoid is a cranial bone. The lacrimal bone, or lacrimal bone, is a paired bone. Now, it is the smallest and most delicate of the facial bones. It's about the size of a fingernail. The lacrimals are located at the front part of the medial aspect of the orbits. As you might gather from its name, the lacrimal bone or lacrimal bone is involved in the process of lacrimation or crying. That is, the bone contains a little fossa or a little indentation that holds the lacrimal sac. Now the lacrimal sac is a little membranous pouch that holds your tears. Now our final facial bone and our final keystone facial bone is the mandible. Now the mandible is a single bone. Now it develops as a right and left, but the two sides fuse completely at the midline, so that the mandible is effectively a single bone. Now the mandible represents the jawbone, or some refer to it as the lower jawbone. It is the strongest bone of the skull, and it surrounds and supports the lower or mandibular teeth. Now you have seen this bone before when we discussed the cranium. Recall that the mandible articulates with the temporal bone to form the temporomandibular joint, or TMJ. By the way, this is the only articulation that the mandible has. And also remember, as we mentioned before, the mandible is the only movable bone of the skull. So looking at the mandible by itself, we have the body of the mandible here. We have this vertical portion, it's called the ramus, here. Where the ramus turns into the body, we call that the angle of the mandible. And this area up top between these two processes is called the mandibular notch. Now here we see the condyle, or condylar process, or condyloid process. And remember that this is the part of the mandible that articulates with the temporal bone to form the TMJ. The coronoid process, we'll revisit this process when we discuss the muscles of the face. We have the mental foramen here on the chin. Remember, mental pertains to the chin. This is the exit for the mental nerve. And these are the mandibular teeth. So here's a standard dental panographic x-ray of the oral cavity. Now to keep you oriented, here's your midline. These are maxillary teeth, and so these are your mandibular teeth. This void here represents the maxillary sinus. And so we have the right maxillary sinus, and we have the left maxillary sinus. Here is your left condyle, and your right condyle. Here are your coronoid processes here and here. And so this is the mandibular notch. Here is the ramus. Here is the body of the mandible. And this area we call the angle of the mandible. Okay, those are the facial bones. So do you need a mnemonic? Here it is. M for maxilla, Z for zygomatic, P for palatine, N for nasal, V for vomer, I for inferior nasal concha, M for mandible, and L for lacrimal. And we have mysterious zombies prowl the night, venturing into moonless light. Mysterious zombies prowl the night, venturing into moonless light. Maxilla, zygomatic, palatine, nasal, vomer, inferior nasal concha, mandible, and lacrimal. So in our next lecture, we will take a look at the dentition, or the teeth, and differentiate the various types of teeth. And finally, we will examine the role of the skeletal system as it relates to digestion. So I will see you shortly for that lecture.